In this next module, I'm going to introduce you to survival analysis and tell you about the statistics that are used to compare time to event outcomes between groups. We talked about time to event variables at the very first week of this course. So a time to event variable is something that you can collect only in a randomized trial or a cohort study where you're actually following people over time. It's a hybrid variable. You're measuring the amount of time that they contribute to the study before they have the event or until the study ends or until they drop out of the study, as well as you're recording whether or not they actually have the event, because not everybody will have the event. This might be something like time to death or time to heart attack or time to chronic kidney disease. People who don't have the event are said to be censored, and that is recorded as well as the amount of time that they contribute. So the time to event variable has a time part. That's the time from when you enter the study until you have an outcome or you're censored, meaning you leave the study without having the outcome. The binary part of the time to event variable is just whether or not the subject had the event. And again, subjects who don't have the event are said to be censored. For time to event outcomes, survival analysis, there's a couple of different statistics we're going to be talking about in this course. So I mentioned already in week 2 of the course we talked about the rate ratio. I'm not going to go over that again here. I'll refer you to week 2. This week I'm going to talk about Kaplan-Meier statistics. That's the unadjusted way of comparing survival experiences between 2 or more groups. In a couple of weeks we'll talk about Cox regression, which is the multivariate regression technique that's commonly used for survival analysis. What is survival analysis? Again, it's the statistical methods for analyzing time to event data. They get a special name because they're a set of methods. They accommodate data from randomized trials or cohort study designs. Again, you have to be following people over time to collect this type of data. Here's an early example of a survival analysis going back to 1669. This was a curve that someone drew showing how many out of 100 people survive until 86 years of age. So the way to read this curve is we're starting at an age of 0. This is 100 people born in 1669. Notice that this is survival on the y-axis. This is the percent of people surviving out of 100. So it starts at 100%, everybody's born, and then there's a rapid drop-off of survival. So notice that at about 10 years old here, only 64% are surviving. There was a lot of infant mortality back in the 1600s. You get down to about 16 years of age, there's only 40% surviving. You get down to about 20 years of age, there's only a third of people surviving. And you get down to 36 years of age, only 1 in 6, 16% of people are still alive. So if we all lived in the 1600s, most of us would be dead by now. So it's a really good thing that we live now and we have modern medicine. Modern medicine has really, really drastically improved survival compared to this. And this is just a few centuries ago. But this is an example of survival analysis. What we're trying to do, the goal in survival analysis, is to figure out this survival curve. We start at 100% and drop off from there. We're going to draw some curves today called Kaplan-Meier curves. And essentially that's what we're trying to do. We're trying to define what percent of people are surviving. Surviving is going to be used loosely because we're not always going to be talking about the event of death. We might be talking about other types of events besides death. But this was developed, these methods were developed around death, around survival. And there's all sorts of things we can ask about this curve, like what's the shape of this function? This is sort of an exponential curve you're seeing here. We can define the curve based on what's the chance a person survived past a certain age, past 20, past 36. When we talk about the Kaplan-Meier curve, that's essentially what we're doing. We're saying how many people survive event-free past certain time points. And this is a survival analysis. We're trying to estimate this curve. We're going to do what's called a non-parametric estimate of this curve, an empirical estimate of this curve. That's a Kaplan-Meier curve in just a minute. Again, this doesn't have to be time until death. It can be time until any event that you want, any binary event.